Welcome to Crowning Around, where every woman wears a crown, whether she's 17 or 70. I'm Joan Caliendo, and this is the space where magic happens when women empower women. Each week, we'll dig into topics like ageism, stepping into your power, and everything in between. And today, we're kicking it all off with a queen in her own right. Me, Ms. New York Senior America.
Hello, everyone, and welcome to our new year, new you, new show, January the 13th, and it's our 13th episode. And we are so excited to have as our guest tonight, Dr. Meredith Vandegrift. Meredith is here for us to talk about everything that you could possibly want to know about plastic surgery and her immense practice in Huntington, New York. But we're going to begin by saying we welcome you back to 2026 with all blessings and goodness around the corner. We were just discussing it's the year of the horse in the Chinese zodiac, and we're talking about moving forward, dare I say, galloping into the new year with drive and dedication. And I would be remiss if I didn't say the following, that my son has moved to Italy for the next 6 months to play professional football in the city of Milan, and I wish him Godspeed.
Awesome.
And I also said that I would be very, very polite to remind everyone that while we were at the consulate in New York City, a very kind gentleman at the parking garage by the name of Freddie was kind enough to allow me to stay in his little cubicle and stay warm while we went through the proceedings for a visa. So this is a shout out to you, Freddie. Thank you. I do appreciate what you did for me. All right, let's start with our beautiful guest, Dr. Vandegrift, Meredith, and put up her headshot. Would you please, Bobby? And then follow that up with a little retrospect of her 2025 year with her family. So here she is, looking lovely as ever. And then please put up the video that shows what she's leaving behind in 2025.
And with that, the 2025 season comes to an end.
I take one look at you, you're taking me out of the ordinary. Why would you lay me down so dead and buried?
I love it. Do you feel the energy in the room?
I do.
I feel it too. Okay, so let me give you some of the credentials of this lovely lady. And the reason why I have her here is because she is real, she is honest, she is genuine. She is really a precious light amongst the people in any room. And I'm so proud to have you here today. So thank you for coming.
Thank you.
So we start with... let's rock our resolutions because we're going to go moving forward to talk about all the things that we can do to better ourselves. And it's not always about surgery. It's about feeling better and feeling confident. And that's a specialty of Dr. Vandegrift. She comes to us from Stony Brook University Medical School and has, as I mentioned, a thriving business in Huntington, New York. Her focus is on natural, hear me out, long-lasting results and custom-tailored treatments, which include skin renewal techniques, including injectables, lasers, and science-driven skincare lines. From tummy tucks, we're going to talk about it all, to breast augmentation and liposuction. I'm in on that. The goal is to feel well cared for. And she is someone who relates to her patients on a very genuine and polite and caring level. And I think that's what's made you very successful. So welcome and thank you for coming.
Thank you. It's great to be here.
It's great to have you. So we're going to start with our Queen's Court, but we can't go any further. We can't without recognizing this amazing photo shoot that she went through for Beauty Affair magazine. And you just have to linger on this photo for a few seconds. Okay. Now that's a work of art. That is this lady mimicking the very famous movie, right? American Beauty with Kevin Spacey before his fall from grace.
Mina Savari.
Yeah, and Mina Savari, who looks beautiful still till this day. Give us your feedback on this. We need to know the inside dirt.
I mean, it was an incredible experience.
Tell us.
Obviously, there was incredible talent with my photographer, Catherine Nunez.
Wow.
it was a little surreal. I have to say, I've never modeled. Obviously, I'm a doctor. That's not
Right.
my thing. And it was hard. It was definitely harder than I thought. That's a
Uncomfortable?
bed of plastic roses.
That's a bed of plastic
Yeah,
roses,
yeah.
very strategically placed, I
and
might
then
add.
there's free petals that were taped onto me.
Oh, good. No
Yes.
wind,
Yes.
right?
No wind. Nope.
That would have ruined the look. And did you feel uncomfortable in that
I mean,
position?
it wasn't the most comfortable place to be, but but I enjoyed the process. It was
You
it was very cool for me to see how another field works, another
Okay.
avenue.
And no self-conscious moment in that?
I mean, in the beginning when I had
Sure.
to strip down,
Disrobe.
obviously,
Yeah.
to get there.
Right.
But I was with a group of women that I love and respect, and everything was very professional, and I just really got into it. I loved it.
And it shows. I mean, when Lindsay Alessio was here, who is the owner, editor, production person of Beauty Affair magazine, we said this isn't just a magazine cover. This is art. That's how we described it.
Oh,
And
yeah.
I could linger on it all day. I've sent it around to everybody who would love to look at that and posted it all over social media, and everyone's reaction is the same. Boy, that's self-promotion. I mean, if you're going to be a surgeon and you're willing to pose in that manner, God bless you, because you're the person I want operating on me if that's the final product. I just love everything about it, and I think it's so liberating and freeing and wonderful and beautiful and all of the above. So I wanted to hear that from you too.
Thank you.
And
Thank you.
You're welcome. All right, so let's get into the Queen's Court, which is where we start to talk about questions that, probe into, your industry, your line of work, your professionalism. And I came across this quote because I'm such a school teacher. I always do my research and I plan my lessons in this way. And I just loved it. Beauty begins the moment you decide to be yourself. And that was spoken by Miss Coco Chanel.
Love that.
So I love it too. And with that premise, I thought I'd ask you this question. After your consultations and before the procedures with clients and patients, what is commonly the greatest request or misgiving surrounding your service? What are your patients saying to you in consultation before you go through a procedure with them?
I think most commonly women come to me and they're almost embarrassed that they want to do this for themselves, or they feel guilty because they think they're taking time or finances away from their family to do something
Interesting.
just for them.
Interesting.
And so I have to give them permission that it's okay. They really just want to feel better about themselves. They don't want to be on the cover of a magazine, or they don't want to, a lot of women say, I don't need to wear a bikini, and I would say, well, why not? I mean,
Right.
it might be very attainable for you. And so why wouldn't you want to have that option for you if that's what would make you happy?
So I love that you said you have to give them permission for it, because still 2026, we're hearing women say, I am not valued enough in my current state, but I'm afraid to move forward and fix or transition into something because of finances, or perhaps I'm not worthy of these improvements, and maybe my age is too advanced to start to do these things. So tell me, how do you get around that in the consultation process?
Yeah, I mean, I operate on women as young as 14 to women. I just operated on a woman on Monday who was 78.
Wow.
And
What did she get?
a breast lift.
Wow.
And you know what? Good for her.
Good for her.
She's super young, in spirit and
okay,
mind, and
okay.
and her breasts were bothering her. She had implants that had ruptured, and they need to come out anyway. And she's like,
Okay.
"While we're there, can you just give me a little lift?"
Okay.
I said, "Why not? We're
Why
living
not?
into our 90s now, so that's another possibly 20 years of
Yeah.
feeling comfortable in your own skin. Like, why wouldn't you do that?"
Amen. I agree. Okay. So obviously people feel comfortable with you after you talk to them and you give them the permission that they need.
Right.
So the question is now, and we talked about this, would you ever say to someone, I really don't feel that that's a necessary procedure for you? I think that, or perhaps you've done too much already.
Yes,
That's a hard conversation.
it is. It is.
So tell us about that.
So I do say no often, and my friends will say
Attest to
that.
that,
They'll
yeah.
attest to that because
Okay.
I don't want anyone to overlook overfilled or too plastic or too fake. Not that anyone that I really, not most people who come to me are pretty realistic.
Okay.
But sometimes there are things that are not attainable, and I just have to be very honest with my patients and say, look, I think I see what you see. Unfortunately, there is not a tool available to me right now
Okay.
that can address that in a way that I think is going to be worth your time, your money, and also my satisfaction, because I don't want to do a procedure. I don't want to take your money
Right.
and you not feel better afterwards or not look better afterwards, right? Like
Okay.
that's just how I operate.
Do you do that imaging thing where you show them what it could possibly look like?
I
You
don't. No,
Okay,
I
some
never.
people do that, right?
We actually have it in our office. I've actually used it once, but it's
Okay.
not really part of my practice.
Okay.
But
Or how about a young girl that comes in who just doesn't have the self-confidence that she needs yet and wants to look at this procedure as a way to get valued? Would you have that conversation with her that this isn't going to fix the inner portion that you need to develop?
yeah, I mean, it's a fine line. Look,
It is.
they say 15% of all patients that seek out plastic surgery have body dysmorphic disorder. And I've certainly seen that. And I think there's a continuum, not everyone is like a clinical diagnosis, but I
Right.
think, there is a fine line between, I want to feel good about myself, or is this going to make me more popular? Is this going to make me
Right.
get that job promotion? Or is
Right.
this, and even in those instances, I mean, when I was in training, there was a woman who came in for a facelift. And when we came and rounded on her the next morning, the attending and I, the person who did the surgery, I was his, student. She looked in the mirror and she said, "Thank you. You've now given me 10 more years on air."
Oh.
Which is a reality.
So I
for
guess
some
it depends
people.
on your career
So,
as well.
Yeah.
Okay, so what I'm hearing, first of all, are the majority of your patients female?
95%,
95%.
maybe higher.
Okay. So what I'm hearing is, are we still in the phase of women not seeing themselves for who they are and feeling the need to maintain, fix, spruce? Or is it social media driven that we're seeing perfect people around us at all times? I watched the Golden Globes. Did you see
Yeah,
them?
I didn't.
Oh my gosh. Those are some perfect people.
Yeah, I mean, I think there is a lot of social media influence, but I think a lot of
Yes.
that is honestly in the younger generations. The women who are coming in my age are saying, "You know what? I just want to feel like myself again. Like I don't recognize my body when I
Right.
look in
I
the
had
mirror."
children.
Exactly. My breasts are deflated. My stomach is stretched out. I used to have a flat abdomen. I used to have fuller breasts. And I just want to be able to put on a shirt or a bathing suit and feel good again.
And what's so wrong with that?
Exactly.
Nothing.
It's just, it's restoration, right? It's restorative surgery.
Restorative surgery. Okay. So then again, maybe here's the question that I'm really asking you. We see, obviously, social media, television, the movies, we see people that become unrecognizable as they age out. And is there a period where you say, let's just do this gracefully and let's just limit, and I guess that comes back to your honesty and consultation, right?
Right.
So it's not always a quick fix.
No.
And it shouldn't be.
No, it's a long game. And
It's a long game, right?
I try and tell patients, listen, you can go, there's lots of med spas around town and everybody it's a business, right? And you have
is.
to pay your bills. I'm a surgeon. I offer injectables because I want to give my patients all of their options and I want to be there for every step of their aging process.
Right.
In your 30s, it's Botox. 40s, maybe you're starting to dip into fillers. 50s is when most women start to consider a facelift if that's something that they want to go forward with.
Yeah.
And I want to gently guide you in that place so you do it in the most natural way possible, right? Like you don't need to start getting 8 syringes of filler when you're 25 years old.
No.
To look like some celebrity. Like that's just, that makes you look older.
Okay, so again, interesting. So women in their 55 plus range didn't grow up with the concept that plastic surgery was the way to go. And there was no Botox and there was no filler and, you got your eyebrows waxed. I don't think I had a manicure till I was 25. Yeah, it just wasn't the trend and it wasn't the circles I was traveling in as well. But I'm saying now that I think it is normalized. And I think the value of it is not about vanity. It's about self-care.
Yes. I
So
say that every day.
Can you say that to our audience? Because there's a part of what I'm hearing you say and other women as well, that there are people that walk around with their bandages and they tell you who their surgeons are and God bless. And then there are people who are ashamed to even ask to get the procedure. And then, why are you being so vain and why are you pursuing this at your age? Can you elaborate on that?
Yeah. I mean, I say this every day. I tell patients every day, it is self-care.
It's self-care.
We dye our hair. We get our nails done.
Yes, we do.
Pluck our
We
eyebrows.
whiten our teeth.
Exactly. There's all of these things. So I look at it as, well, Botox is just on that continuum. You've got some wrinkles that you want to soften or just prevent from getting deeper. Right. Just a little tweak, just something to like soften the hands of time, and why not? I mean, it's
And it's
It makes you feel good
accessible.
about yourself.
Right.
So why wouldn't you do it? It's not harming you or anyone else.
Right.
You know?
Right. And we're not seeing any long-term like problems with that kind of usage.
Yeah. I
Not
mean,
yet.
Botox has been around for 26 years.
Has it been?
Longer, but cosmetically it was approved
Where
in
was I
2001.
26 years ago? Definitely not thinking along those lines, because obviously when it was first coming out, people were like, it's botulism. And why would you put that in your face?
I
Right?
used it I was the lab geek in school, pre-med. I was using Botox, dissecting fruit flies. Like literally, it was that kind of a thing, pre-med. If I only
Interesting.
knew
If you
what
only
I had
knew
my
the
hands on
career that you would be
in
involved in.
1997.
Okay, so then maybe also tell our viewers who should be doing what procedures, because there are people that go to Botox parties. Interesting to me.
I do them.
But you're a
to be fair,
surgeon
I do.
and you're a doctor.
I do them for my friends. I do.
All right, that I would go to.
Or friends of friends. I
you
do.
know, but that's not the parties I'm getting invited
sure.
to. So tell me, med spas, estheticians, surgeons, board certified plastic surgeons. Tell me the pecking order and what's the correct
Right.
person for the job.
I mean, look, when I first went to practice 10 years ago and I was, trying to amass a patient base,
Right.
Botox was my hammer, right? I wasn't really getting a ton of consults in the beginning, cosmetic consults. And some of my patients actually became injectors. And I was almost offended because I said, everyone, there was like this encroachment onto the field. And, 9 years later, I've let that go, because honestly, there are some really great injectors out there that are nurses. They're PAs.
Yeah.
They're,
Of course.
my nurse practitioner, like she will inject me if I ask her to, so the shift has changed it a little bit.
Okay.
And I think that experience matters more. So if a nurse or a PA has been working with a plastic surgeon for the last 10, 15 years,
Right.
like I would trust them over
They
someone who
learned
just
their craft.
graduated.
Right.
Right.
Oh, of
They've
course.
learned it. Right.
They've learned.
But surgery's a different game. Surgery, you need to go to someone who has the training and the certifications, because there's a level of safety, there's integrity, there's ethics involved
Yes.
that you don't get in a 1-year certification. You just don't.
Okay.
There's anatomy.
Of course.
That you
But
can't learn
these
in a
are,
year.
You're talking to educated people and explaining that to them carefully. But then there are
Right.
people jumping on planes and going to Korea
Yes.
and Brazil,
Yes.
dare I say. And a lot of men are doing like hair transplants, right, in these
Which is
locations.
in Turkey,
In Turkey.
#1 place for hair transplant right now.
Yeah, what is that?
Yeah. I mean,
Because
look,
that's affordability, though, yes?
it's affordability. It's prohibitively expensive here for a lot of reasons. I was just having this conversation with one of my patients today, because the problem is that the United States subsidizes a lot of things for the rest of the world. Like if you think about medications, we pay more for our medications, so that in India they don't have to pay as much for an antibiotic that here we
Interesting.
pay,
Yeah.
a lot more for. So that's part of the problem. So I pay more to buy my Botox here, which means I then have to charge my patients
I see.
a certain amount, right? So there is that, but a lot of it's people do what they can afford.
People do what they can
But you just
afford.
have to be careful with the safety of it. And there are great surgeons in Brazil. I mean, they invented a lot of the things that we do now.
BBL.
Right?
Do
exactly.
you do that?
Not a ton. Not a ton. I generally, first, those patients don't seek me out because I have natural all over my website. But the ones that I
Shocked
do,
that you're not the number one surgeon of BBLs in Huntington. Okay.
I do small volume injection. I do for
Oh,
balancing
injection.
and shaping.
Oh,
Yes,
okay.
Yes.
Okay.
Yes. It's a balance. It's liposuction in some areas and then injecting in other areas to create a nice silhouette. And I do that procedure. But
Cellulite, can you get rid of it?
we can make it better.
Make it better.
We can.
Yeah. And it's also
There's-
genetics as well, right?
It's very genetic. Weight, if you're thinner, it's less apparent. But I know lots of skinny people with more cellulite than heavier people. It's
Right.
genetic.
It's genetics.
Yeah.
Okay. Always
Yeah.
comes down to that.
Yeah.
All right. This is fantastic conversation. We're going to take a short break and come back and do a little bit of what you may have seen on Instagram or Facebook, where I ask the plastic surgeon to rate from 1 to 10 what she thinks are the best procedures and why, so that you may be on this list of this may be your checklist of what you need to have done for the new year. And she's going to give you her honest opinions on each one of these procedures. So when we come back, we're going to talk to Dr. Meredith about that. Thank you.
Ever felt stuck with a home that just doesn't feel right anymore? Whether it's that outdated kitchen or the bathroom that needs a refreshed look, Twice as Nice Construction has got you covered. Family owned for over 20 years. Twice as Nice Construction has been providing beautiful new construction and additions and stunning remodels like kitchens and bathrooms. We're not just experts. We offer unbeatable quality and prices to help make your dream come true. Ready to start building your dream home or to give your kitchen and bathroom that much needed makeover? Contact Twice as Nice today and make your dream a reality. Visit twiceasniceremodel.com today for quality you can see and service you can trust. Twice the value, twice the commitment, Twice as Nice.
Imagine turning an ordinary gathering into an electrifying night at a Las Vegas casino. With Ace Authentic Casino and Entertainment, we bring the thrill of blackjack, roulette, poker, and more right to your door. For over 20 years, we've been transforming parties in New York, New Jersey, and Connecticut into unforgettable events. Ready to elevate your next event? Experience the joy today with Ace Casino Parties. Visit us at acecasino.ny.com.
Hi, and welcome back, everyone. New year, new you, new resolutions, new concepts. I say new yes to everything. That's what NYE stands for in my book, not New Year's Eve, new yes to everything. And I wanted to say that we have the pleasure of being with a board-certified plastic surgeon this evening. And we're going to have Dr. Vandegrift rate some of these procedures. She's going to explain them to us as well, because I'm just going to, label them as they are. But she's going to give us on a ratio of 1 to 10 what she thinks are the best procedures, why they're the best procedures, when they're age appropriate, when they're not. And these might be on your checklist for this year because, as we mentioned in the first part of the show, self-confidence, self-care, self-awareness is really what we're all about. It's the year of the horse. Come on now. Bold moves, big decisions, galloping into the new year. What other puns can I use? I'm just trying to say that, putting a new spirit and an energy into the new year is what we're really discussing. And some of these procedures are at your disposal, and some of them you may have had questions about, and she's here to address those. So we're going to start with chemical peels.
Love them.
Okay, tell me why.
8. It takes off the top layer of your skin and just reveals newer, healthier skin underneath. So it'll address fine lines, brown spots. It's a great treatment.
And you're using acid?
You can use acid. We also have lasers that peel too.
So is that
similar.
The new trend? The laser is the better technique?
It's not that it's better. I think that different estheticians feel comfortable with different technologies. So I think an esthetician that has experience will pick the one that he or she thinks will get you what you need.
Okay. Now, there are degrees of chemical peels. There are ones you can go in the afternoon and go back to your job, and then there are the ones where we see the people with severe sunburn, eyes are shut, neck is cracking. Where are we? What level are we supposed to be at what age?
I mean, starting a light peel in your late 30s, if you have signs of sun damage, is a great stepping stone.
No one was saying this 30 years ago when I was in my 30s, 30 years ago. So, and it's regenerative. So the skin that comes up.
You're building more collagen that way. It's like you're creating a controlled injury on some level. A lot of these technologies, you're creating controlled injury. So your body makes new collagen, which is the building block of skin. That's what we're missing. That's what keeps us. Yes, that's what keeps us younger.
All right. Speaking of collagen, I've been to so many expos since winning the crown. There are people putting these little powdered additives into everything that they drink. Mm-hmm. Yes or no?
Not a lot of great data. That being said, I do put creatine in my coffee in the morning.
Creatine,
because that data is actually, there's more data emerging on that.
What does that do
for women's health? It helps maintain muscle mass, particularly if you're lifting. So for women, that's obviously important. We're losing muscle mass as we get older. I mean, everyone is, but women in particular, we need to, postmenopausal, we need to be thinking about that.
So much to think about. Okay, so the collagen powders, the creatine might be, doesn't that pull water though from your muscles in a particular manner? Like my son was doing creatine for a while, trying to build
different. Yeah, a little bit different.
And because he's male, it's a different.
Different, yes.
Okay. Yeah. I don't need that. Okay. Lip filler.
7 if done conservatively.
What are you filling the lips with?
I use Versa. It's my favorite filler for lips. I have it in my lips. It's a nice, soft, natural product. You know, every injector has their favorite product. So, you know, what I like might not be the same as what somebody else likes, but in my hands, that's a really nice product for lips.
You said natural. So elaborate on what we're seeing in Hollywood.
Thankfully, we're stepping away from the overfilled look. Thank goodness, because
Right.
that was, you know, a little cartoonish. It's just about replacing volume, you know, and I think the lips in particular, I don't think the average person knows what the natural lip anatomy is because it's been so blown up and skewed by social media.
Okay.
A lot of my consults are just about educating patients on
Yeah.
normal anatomy, right?
Normal.
So your top lip is actually supposed to be smaller than your bottom lip. But
Yeah.
if you look at some of these people online, they're, you know, the ratios are off and it's not aesthetic.
It's not aesthetic,
So,
but it's definitely, dare I say it, a look that people think is sexually appealing at this point in time because so-and-so even put, you know, pieces, additives into their upper lip,
Right.
right? So that they don't have to do the filler.
Right.
And it's like a surgical procedure that's always inflated.
Right.
It's just very interesting how lips have become the focus
Right.
of a new sexual identity. Very interesting.
yeah.
No one worried about their lips in the 70s.
No.
No. But then again, fine lines, those are hard to get rid of above
Right.
your lips.
Right. Which sometimes filler there is a nice choice.
Is a
That's
nice
why I don't
choice.
want to discard it completely. You know,
Right.
it can be a good choice.
And before we went on air, I have to say this. Dr. Meredith said that she does her own fillers and Botox in the mirror. I said there are hairdressers that will not color their own hair because they're afraid of making errors. And she said, well, you know, that's because there's stuff in the back. And I
Right.
said, you're injecting yourself in a mirror. She said, well, my nurse practitioner is with me
Yes.
and giving me some sound advice. But explain to them what you said about your routine and how it's, you know, minor and consistent. Right.
I tell my patient, look, people come to me all the time with issues or complaints about lines and things like that. And I say, well, this one's due to volume loss. This one's
Right.
due to motion in your face, you know?
Right.
And whenever I mention filler, most patients say, ooh, not for me. I don't want filler. And then I say to them, well, I have filler in my face.
Wow.
And they look at me and they say, you do? I say, yes, because if you do a little bit at a time,
Right.
just replacing what you're losing a little bit over time, you will maintain your natural landmarks that make you you, right?
So smart.
You don't want to obliterate those natural landmarks that make you you.
And you don't want to look constantly surprised.
Correct.
We discussed that as well.
Exactly.
All right. Here's the next new guru technique, micro needling.
Love.
Tell me about
Love.
it.
It's collagen induction therapy. So needles going into your skin, puncturing it at a specific depth, depending on the area of your face. Same thing. It's creating that controlled injury. So your body's going to lay down the framework to heal those little micro, you know, injuries. And you get, you know, it improves your texture. It improves your tone. You get some softening of your lines. I really like it.
How often would you have to do that?
Generally with the technologies where you have less downtime. So we're talking 1 to 3 days. Usually we recommend a series. So maybe 2 or 3 treatments and maybe doing that once a year, once every other year. Kind
Oh.
of depends on how old you are and what your goals
Oh.
are.
That's
You know.
not bad.
Yeah.
Okay. Here's my favorite from the bougie brunch. We were asked to take out raffles and, you know, put them in what we thought we should try to win. And everyone at my table said, you must get the salmon sperm facial. You must. I said, I don't know that I need that. And I don't even know what it is.
I don't know that you need it either.
What in God's green earth is that? And do you like it?
I tried it once and I didn't really see what the
value.
hoopla was about. So
Okay.
I
What
don't
is
offer
it?
that. It's, you know, there's certain components of the sperm that could hypothetically improve
Oh,
your skin.
oh.
I guess there's, you
So
know,
it's a type of facial.
peptides, and it's like a fancy facial. Yeah.
Peptides. Tell me about that. That's another
peptides. I mean, peptides.
buzzword.
Yeah, that's a buzzy thing, right?
It
a
is
lot
a
of these
buzzy
are
thing.
fads. You know, again, a lot of these things don't have great data. I'm a doctor, so I'm a
Right.
scientist.
You're
so
a
I
scientist.
like to see data. You know, I do.
Right.
And a lot of these things that don't have data, I'll at least try to see
Right.
if I notice a benefit, or I'll ask one of my friends to be my guinea pig. Say,
Oh
hey,
my.
I've got this new thing. Do
One
you
of
wanna
those
try
parties.
it?
Okay. And the peptide story is replacing collagen or it's it's in conjunction with developing new collagen.
It's its own beast. It's not something
is.
I offer, but there are some studies that show there can be a benefit. So I think you need to go to somebody who is well versed in these things and does that. It's not something that I offer.
Not something you offer. Okay.
But
Red light therapy.
I like it. Yeah.
Okay, so I have to share with you this. So I have to have my hip replaced in March. Oh my God. I know. But going to HSS, Dr.
Okay.
Shen, I'm ready.
Awesome.
So I said to my daughter, get me one of those red light therapy masks because I'm going to be sitting in the bed for 2 weeks.
Right.
So I tried it on Christmas morning. I'm a little claustrophobic. I don't know that it's gonna work if I put it on and take it off. So tell me the benefits of it, and I'll suffer through the claustrophobia.
I put mine on at night
Do
before
you?
bed, and my boyfriend says, "Can you not do that when I'm here? Because you look like you're Jason from."
Yes, you sit up in bed and you have that mask on, and it's heavy and
It's heavy
cumbersome.
and it's sticky and hot.
Yeah,
and
but what are the benefits?
I've
Tell
read
me.
some studies that show there is an improvement in fine lines and texture,
All
and I
right.
definitely after a treatment in my spot, it definitely takes the red out faster. So I love it just for that.
Okay, and it's
After my
definitely
microneedling, when I get the red light afterwards, I leave the salon, the spa, and my redness is almost completely gone. So it is great for that.
and it's definitely red. What's the blue and the green and like there was options,
different wavelengths,
different
do different
wavelengths, but we
things.
want red
Yes.
for renewal
for
purposes.
rejuvenating. Yes.
Rejuvenate.
Yeah.
Press the right button. Okay, I've talked to you about this personally. I'm not a big fan of the tummy tuck because it's a big procedure. It's a big surgery.
It's a big surgery.
But I do like the option of liposuction, and I know you do that frequently. 1 to 10, where would you put it?
8.
Okay, why?
It would be a 10 if everybody had perfect quality skin. So you just have to choose the patients, correctly and lay crepe. You have to, there's a lot of setting expectations. Liposuction is a great tool, but sometimes if you have too much skin, it's not going to be the only tool that you need.
Okay, so after menopause and you get that little pooch and, it's impossible to get rid of with diet and exercise
Right.
because I'm telling you, I diet and I exercise
Right,
all the
yeah.
time. And it's just the natural formation of your body at
Yep,
this point.
absolutely.
Right? Things drop, gravity takes over. No peptides. Whatever I'm putting in my juice is not working. So I say to you, liposuction is the removal of fat that is not going to go elsewhere.
Yes, thank
So
you.
please tell us
Yes.
about that because that's a
Yes.
misconception.
It is.
Okay.
When we perform liposuction, so on an abdomen, right?
Yes.
We're targeting a specific area where there's extra fat,
Right.
right? We have fat everywhere in our bodies,
Yes.
and you can't remove every single fat cell in any given area.
Right.
We're removing like the safe layer. There's 2 layers of fat in our skin, right? There's the layer right under our skin, and there's a deeper layer, particularly in our abdomen. So we're
Okay.
hitting that deeper layer. It's because we don't want to create defects in your skin and things like that.
Right.
Those fat cells are gone forever, right?
Forever.
So, forever. They're gone. The remaining fat that you have is going to shrink or it's going to grow depending on if you lose weight or gain weight,
Okay.
right? So I tell my patients, if I perform your liposuction and this is your new shape, this is your baseline, and you go and you gain 50 pounds, you're going to gain 50 pounds everywhere. But the area that I remove that fat is going to remain flatter relative to the rest of you because those cells are gone, right? The cells that remain in that area will still grow, but
Right.
you're going to maintain your shape.
Okay, so the misconception was they will all develop in your rear end,
Right.
right? And then you don't want it there.
Right.
And are there people who also, again, I may be talking out of term, as you're taking out the fat cells, they have them injected into their
Yeah,
breasts?
we can do that. I do that. Yeah. Breasts, buttocks,
Butt.
wherever. Yeah. Face.
Base.
Mm-hmm.
Okay.
Liquid gold, that is.
In certain areas.
In certain areas.
Okay. And then what about those techniques? I'm not going to say this correctly. Sculptura, the icy thing that goes on where people, you know what I'm talking about? As opposed to liposuction, they go and they have like
Cool sculpting.
cool sculpting.
Cool sculpting. Cool sculpting was great when it first came out.
Okay.
It's dated technology at this point.
Oh.
I mean, there are still places that do it, and there's definitely places where you can get a reasonable result. I tell my patients, cool sculpting is not a one and done, right? So
Right.
I can get a more reliable result with one quick trip to the operating room with a liposuction treatment, then, maybe 4 or 5 sessions of cool sculpting, and then it becomes more cost effective to get liposuction.
And the downtime for liposuction? Asking
be-
for a friend.
Could be a week,
A week?
Yeah. I mean, you're not going back to the gym at 1 week, but you're
No.
back to the office within a few days, really, depending on where we do it.
Oh, do you do this in your office or you have to go to a hospital?
I have an operating room in my office. So I
Very
do it
efficient.
it's very efficient. So I can do it awake. Some areas are very amenable to being awake for it. And then you have even less downtime because you're not recovering from anesthesia. Yeah, I do chins all the time, necks, chins under local. Yeah, patients are awake. It's very tolerable.
Wow.
Tummy's less
I
so.
know. Necks are a big thing now.
Yeah.
We never paid attention to our necks.
No, but
never.
But we never stared at ourselves on a screen all the time
No.
like we do now with working from home and
I'm glad
remote
my
and-
vision is going. I look better and better every year, but it's because my vision is going.
My busiest month in practice to this date was June of 2021 or
after
20,
the
right after the
pandemic.
pandemic, when we were allowed to see patients again.
Yes.
I had so many people come to me and say, just give me some Botox. I'm so tired of seeing my face. I didn't know I had this wrong and that wrong. And we're not meant to look at ourselves like that nonstop all day, every day.
Well, have you ever FaceTimed? And
Yes.
Wow.
You have to hold it up here because
Yeah, well,
this is
again,
not a good angle.
hard lesson to learn the first time you do that. Yeah, it's a bad angle. And I don't have that little light attached
you
to
need
my
your
phone.
ring light. You need your ring light.
I need a lot of things. Okay, I don't know that I say this correctly either. Blepharoplasty.
Eyelid lift, 12
Eyelid
out of
lift.
10.
12.
12 out of 10.
Tell us.
I had mine done when I was 37.
Okay, stop it.
Genetically, everyone in my family or on my mom's
Hooded
side at
lids?
least, hooded lids. I couldn't put mascara on by the time I was 37. I had so much skin. You don't realize how heavy that skin is too. I had a patient, I've done more blepharoplasties in 2025 than I did in the previous 10 years of practice. And one of my patients said to me, in recovery, my eyelids feel so much lighter now. And she wasn't even that bad, but they're heavy. You don't realize how much weight that is on your lids because it's such delicate skin.
Yeah.
Until you have it removed, it really is. It's functional as much
a
as
game
it is
changer.
cosmetic.
It is. It's a game changer.
Yeah, I've had women tell me that they couldn't read at night because their eyes just got too heavy. And after they have their eyelids done, they say, I'm up reading now at night before bed, and they're so happy.
Now, if you do up, do you have to do lower?
No.
No.
You don't have to.
You don't have to.
Uppers, I almost exclusively do under local. Another nice little procedure to do without having to go to sleep.
Wow.
Yeah, lowers are a bigger deal.
Yeah.
Yeah.
Okay. Did I leave out what would possibly be the number one procedure that you've done this year? Did I not ask you about something that is something you frequently do?
I would say skin tightening. So Renuvion has been kind of the hot.
We don't know about
hot-
that.
yeah,
Tell us.
Renuvion
Skin
is
tightening.
Skin tightening. So skin tightening is the holy grail. There's no one perfect
Okay.
modality, but the Renuvion, I've had this technology for about 4 years now. And the longer you have something, the more comfortable you get with it. You can kind of push the envelope. And I'm getting really nice results now because I'm comfortable with this technology. And for the necks in particular,
Wow.
I mean, patients that I would have said, you have to have surgery to fix that. There's no way I'm going to get you a decent result that way. And I'm surprised at how much tightening I get with this tool.
What does it do?
really, it's like shrink wrap. It goes in under the skin after I've lipoed most commonly, and then it addresses the bands that are connecting your skin to your deeper tissues, and it basically causes them to contract. So it's almost like shrink wrapping your skin.
Wow.
Yeah.
What about threads? I just thought of that.
Not a fan.
Not a fan.
Not a fan.
Housewives do that.
They're not reliable enough for me to offer that in my practice. There's problems. They're very cyclical. They come on and off the market every 10 years because we start seeing extrusions, infections, asymmetries, and people stop doing them, right? And then a company comes and reinvents them 10 years later and says, oh, these are the new threads, they're better. And people jump on board. And I haven't been in practice that long, but even through training, I've seen this enough and heard from, my, the people that I look up to, my mentors, and they say, don't get into threads. So I just haven't. But I know surgeons who do them and they get nice results.
And they have nice results.
Yeah,
Okay.
just
so
not for me.
What I'm hearing from you after this long list of procedures is, you take the time to do the research, you read the data, and you get to a comfort level, which allows you to be honest and open with your patients, which is why you're successful, right? Which And I have to say this. I mean, I think women feel more comfortable going to you when you say to them, "Oh, I just got filler in my face and I had my eyelids done when I was 30." Just think that's a more comfortable thing for women to hear. Maybe because this is so archaic, we're still feeling judged when it's a man.
1,000%.
Oh, I said that.
1,000%.
And
It's
I'm
true.
right. And I'm right.
It's true.
Oh,
It's true.
wow.
It is true. I mean, look, there's pressure on me too. I'm in the business. I feel like
Yes.
on some level, I have to look my part, right?
You do.
So I do need to stay on top of the technologies and try them and use them so that I'm also keeping myself fresh, right? Which
Well,
I don't
that
think
cover
men
on
feel.
the magazine, I would just walk around with that as my card. I would just whip out the magazine every time I had a new patient. But you're so right. And do you think that plays a little mind game in your psyche that?
I mean, at the end of the day, I'm busy. I've got 2 kids at home. Like I
do.
don't
Buy
get-
into
I don't
all
get
of
obsessed
that.
with it, right? But
Right.
it's in the back of my mind. Sometimes I look in the mirror and I say, "Oh, I don't love that," and then I read about, well, what is the best way to address that? And then I try it on myself or one of my willing friends, and then I offer it to my practice. So
Okay, I love this conversation. Because, did you see the movie The Substance with Demi
no,
Moore?
I haven't.
Mm.
It's on my list.
Okay.
She looks
you'll
phenomenal.
but you'll have to come back after
Okay.
you see that movie.
Okay.
Because, again, it's the price of beauty. Like, how willing are you to extend yourself to a certain point? And,
Right.
not at what age is it too much? Because, as you said, that 78-year-old woman that just got her breasts lifted, God bless. Like,
Right.
enjoy your life,
Totally.
continue on and
Totally.
move about. And so I'm not saying that, but there's a spin-off that's coming from the success of that movie, which is it's called Beauty, and the quick fix of the needle and the injection, and it preserves your beauty, and you can where is the fine line between the ethics and the morality of procedures and so forth and so on. But I think we gave our audience tonight a very clear picture of it's self-care, it's self-maintenance, it's self-love.
It is.
It's what hair color was in the 40s and 50s to women who got their hair done once a week at the beauty parlor, right?
Right.
Sprayed
Yep.
it for the week and felt great about themselves.
Right.
We have all these other options available to us, and there's no harm in trying. But of course, the professionals do what they do, and you do your research,
Right.
and you seek out the people that you can feel most comfortable with, and that certainly for me is Dr. Vandegrift. So, and I'm sure that that's how she came across this evening. So I thank you
Thank
for
you.
all of your expertise. And now I'm going to do our tiara tip of the week. When should a man begin doing some of these procedures?
When it bothers him. I think
Okay.
men aren't as critical of their own bodies and faces as women are.
Do you think so?
I do have some male patients, and they say, I don't want to feel like this anymore. I want my shirts to fit better.
Okay.
I don't want my neck to look like this. And I think
Okay.
that's amazing.
I do too. It's just, we allow men to age.
We do.
And there's
Sure.
the difference there.
Yeah.
Not that we're not saying that we don't allow women to age, but we allow them to age to a point where we still want them to look youthful and vibrant. And I think that every year gets a little bit greater in the number. 60-year-olds definitely do not look like what 60-year-olds looked like, in the 1970s.
Right.
So, and that's a good thing. But my tiara tip of the week is, what would you say to men who are looking for procedures? Same thing you would say to a woman.
Yeah, you're allowed to feel good about yourself too.
Yeah, I
if there's
like
something that bothers you and there's a reasonable way to make it better, then
Right.
do it.
Right. It's not a vanity
That's too
thing.
short. It's not a vanity thing. It's a
vanity
comfort thing. It's
a
comfort. It's confidence. Just feeling good in
Yeah.
your own body.
Love it. Okay, so my royal invitation is for my last show in January, which will be on the 27th. And once again, I am bringing in a former student who graduated, goodness gracious, in the early 90s from Carl Place High School. And I had the pleasure of working with her father, who was on my veteran show, and that is Miss Megan Colligan. Now, let me just explain to you something about the little hamlet of Carl Place. This young lady went on to Harvard. I used to say to her father, it's because she was really good at field hockey, but it was because she was brilliant and she was assertive and she was bold and she was dynamic. And it was at Harvard that she met her husband, and she went to live a beautiful life out in Brentwood, California. and that's her husband, Mark Roybal. And Megan today is the new president of Roque, which is a media capital technologies distribution company. But she was the former president of IMAX and the former president of marketing and distribution for Paramount Pictures. So just to explain some of what that means, Mark, her husband, will take the scripts that people are proposing for the next movies, determine which ones he thinks are valuable, and promote them.
Wow.
He himself is a 20th Century Fox executive, and both of them are voting members for the Academy. So Megan, whom I have not seen, it's got to be over 20 years, agreed when her father came on the show that she would love to be on the program. And we're going to have her on via Zoom, because she does live in California, on the 27th to end out the month of January. And I just continue to be in awe of the women that I invite on this program and the men, because they're power brokers, and some of them are shattering glass ceilings that are around us. And I thought, how appropriate to end the month of January, which happens to be my birthday month. And, we're all getting up there and saying to myself, these are women I love to surround myself with and ask them questions about their field and their expertise, because I am learning so much now in my retirement about things that I never had the time to really think about, and it's a great learning curve for me. So have a wonderful extended Martin Luther King weekend, and as a true Capricorn myself, continue to climb and rise above, and in the year of the horse, gallop into the future and do great things with bold decisions. And thank you so much for joining us this evening. Thank you.
Thank you.